Earlier, we took you inside the ICU at St. Alphonsus in Boise to see the pandemic strain on large hospitals. But the surge in COVID cases is also impacting hospitals in smaller rural communities. Smaller hospitals often don't have ICU floors. Some of them may have just 1 or 2 ICU beds to treat patients. But how does that work out during a pandemic when the demand for ICU beds is through the roof and other hospitals are full? Our Katya Stepovic went to Minidoka Memorial Hospital in Rupert to find out. Inside the emergency room there, slow days are rare. And while COVID is no stranger to medical experts in Rupert, the Delta variant has different, more aggressive and contagious characteristics, causing resources and optimism to dwindle. Kelsey Phillips is the emergency room charge nurse at Minidoka Memorial. She says emergency rooms are constantly full of COVID patients and the waiting rooms are overflowing. The small hospital has 30 COVID beds and just 1 ICU bed.
It's never been pure chaos like it is now. You know, it just some days when we're here, it's all you can do to get out of one set of PPE into the next, to go to the next room, to try to take a big breath in and gasp and go into the next room. It is scary because we've never had to do this before. And you know, every life matters to us. And we can only do what we humanly possibly can do with the resources we have. And on top of COVID, we have other emergencies.
Even with the vaccine readily available, more than 95% of the patients in the hospital being treated for COVID haven't gotten the shot.
Wives in the corners, curled up crying. You want to, be there to support them, but knowing that they've refused to be vaccinated, it's hard. It's hard to support that because that could have been prevented. This can be prevented.
I mean, our whole purpose is to take care of patients. That's our #1 goal, is to make sure that everybody gets taken care of. But when we've got patients that require isolation, you've got a lot of COVID patients, higher volumes of patients, we just don't have the capacity to get people back as fast as we would like to. And we're having to send people home we typically wouldn't. I mean, we've had, patients in their 30s and 40s that are healthy, we're sending home with oxygen tanks that we would normally admit to the hospital because they're having a hard time breathing and needed oxygen, but they're just, not sick enough right now to take up a hospital bed. Like, this is my community, this is my people, and to see them getting sick and not being able to help everybody it's tough.
Because Minidoka only has 1 ICU bed, patients needing higher levels of care are often sent to large hospitals in Boise, Twin Falls, or Pocatello. But those hospitals are also full, and out-of-state hospitals have told Minidoka that they too cannot accept any new patients. While medical workers struggle to find hope and resources, they still show up every day to protect their community. Minidoka Memorial is not currently operating under crisis standards of care, but if trends continue, staff say they are days away from rationing care. Right now, staff are preparing to turn conference rooms into rooms for COVID patients. You can find Katya's special report on ktvb.com or tune into the 208 at 5 p.m. today to see hers and Brian's reporting on the ICUs.